Good day, everyone. Welcome to this discussion I'm going to have with some fabulous, fabulous women as we kick off Black Maternal Health Week and Black Doula Day. Today is April 11th. My name is Melvette Hill, and I'm with the Commission on Women, Children, Seniors, Equity, and Opportunity, where we really strive for equitable access for all. I'm the executive director, and I am joined here today by Dr. Arma and Dr. Njaku. And I'll have them introduce themselves and their work, and then we're going to get into a few questions. Dr. Njaku, why don't you go first?
Thank you, Melvette, for the warm welcome and just for the kind introduction to really be in the space and talking this really important issue. So I'm Dr. Amelie Njaku, and I'm a professor in the Department of Public Health at Southern Connecticut State University. Very passionate about this work and also have a lot of research on this very important topic.
Thank you. Dr. Arma?
Yes, thank you. Thank you again for the invitation. I'm Dr. Tishiana Arma. I am the Chief Psychiatry Officer at Community Health Center Incorporated, which is located all across the state of Connecticut. I'm also an assistant clinical professor at Yale University in the Department of Psychiatry, and this is a topic that is near and dear to my heart, and so I'm really happy to get a chance to talk briefly about it today with both of you.
Thank you. I'm so glad to have both of you here. And this is one of many conversations we're going to be having. So shout out to all of you out there, all the Black doulas, all the Black health professionals, all the women who are working to uplift other women. We appreciate you. And so I want to get into this question, why does Black maternal health matter? We have a whole week. We dedicate time to it. We have a day, April 11th. But why does Black maternal health matter?
It's a great question. I would say first, women and children are cornerstones of our society. And also, mothers are integral parts of families. So they're not just mothers, they're partners, they're spouses, they're sisters. And when you are bringing a child into the world, any maternal death is a preventable death. This is a highly preventable issue. Unfortunately, it disproportionately affects Black women. In some cases, they are up to 2 to 3 times more likely to die while giving childbirth, which is something that is a completely preventable tragedy. And furthermore, and so this is an important issue. It's a chance to raise awareness and to raise activism about this because there are many factors that contribute. And I think when people see these numbers and statistics, they might be they're very shocking, and they might wonder, how could this be? But it's also an opportunity to see how each one of us and all the different factors at different levels can contribute to this issue, and that this is a preventable issue that we can address if we are aware of all of the factors that are affecting this very serious issue.
Yeah, well, I agree with that 100%. I think one of the things that folks don't realize as we think about Black maternal mortality is we think about a lot of these sort of physical problems, but in 2021, substance use disorder and mental health conditions became and it's in the reverse order. Mental health conditions and substance use disorders became the #1 cause of maternal mortality. And while there's still a ton of different causes, those really sort of peaked. And I don't think that's something that people sort of think about. There are factors like the fact that 2 times as many Black women are likely to have a maternal mental health condition, but are about half as likely to actually get care for it. So it's preventable, but there's treatment out there, and those who are needing it and are having an increased need for it are actually less likely to actually get the help that they need. So I think it's important because clearly awareness is an issue and access is an issue.
Yeah, absolutely. Awareness and access. Also, I think some women, Black women and women of color are afraid to use their voices because in many cases people aren't listening. They feel like they're not heard. And we've seen the data shows us what happens when they don't listen to Black women who know their bodies. And we see the effects of that, how that works out in hospitals and when they go home for aftercare. And so voice is so important, right? Understanding and knowing and having access, but also understanding and knowing what's happening and then using your voice. I also think like when we're talking about postpartum depression too, that some women are afraid to say that they're going through that because it's all about the Black girl magic and Black women are strong and resilient, right? And so we're not given permission to be human beings,
Yeah.
right? And to have moments of weakness and have moments of need. And so I think that that's an important concept for people to understand is like, yes, there is all the Black girl magic in the world and all the Black excellence, but we are human beings. We shouldn't be expected to be superhuman. And so I wonder, in the context of, getting into and kicking off Black Maternal Health Week and Black Doula Day, I wonder in your realm of your profession as your expertise and also as Black women, what's one piece of advice or wisdom for Black women as relates to maternal and or mental health?
It actually, the answer to that for me really is kicked off by what you said just now. And I'm going to cheat a little bit. So I'm about to go on a trip to Panama. And when you're in the airplane, they tell you got to put on your oxygen mask first. And I always think about that. And when I talk to my patients about it, I say, you think about it really. If you don't put on your oxygen mask and you need that oxygen mask, the next thing you know, you're passing out. How do you help your child? How do you help your neighbor? You can't. So now you can't take care of them and you can't take care of yourself. And you're right. Oftentimes we really put ourselves on the back burner. And I think that we can't be all things to all people. We can't cheat ourselves. And so just like that analogy of the airplane mask, we really have to make sure that we're taking time to care for ourselves and take time for ourselves in a way that really fits our needs. Okay, so the cheat is that then I get to say a couple of quick things, which are in terms of our mental health, right? So whatever, like I said, fits your needs. Taking a walk with a friend, getting an accountability partner for every day of the week if you need it, writing down your thoughts. And I'm mentioning things that are the things that I'm also doing as a Black woman who feels the weight of, the world oftentimes. So sort of writing your thoughts down if you can't quiet your mind, meditation online or an app, and not hesitating to find a mental health professional for therapy or medication if needed, and recognizing that even that's not one size fits all, right? So if you are with someone who is not meeting your needs, is not listening to you, whether it's your therapist, a psychiatry provider, a physician who is supposed to be taking care of you, know that you can lift up your voice and say, hey, I need something else, or I'm going to speak with my feet, right? And then it might not be a medical professional. It might be your church. It might be an organized group that you need to re-engage with in the community. And really looking to see who has lifted me up, whether it's a professional or it's a community group, really sticking to going back to the places where you're feeling uplifted and you're feeling cared for, and withdrawing from the places where you're not getting what you need.
Oh, I love that. I love that. I hope folks watching are taking notes, but you could also replay it and share it with a friend. We love that. Dr. Njaku, what would you say here?
Just to piggyback off to what both of you said, I really resonated. I definitely agree with what Dr. Armour was saying about well, I would say listen to your body and let them hear you, like let them hear your voices. And I'm going to piggyback off something that Melvet said about, like a phrase that I've heard is believe Black women, right? Because a lot of times these preventable, like whether it's morbidity or deaths, are because people don't believe Black women. And we have to also recognize that that is rooted, there are structures that are structural, that are outside of our control, systemic racism, slavery, stereotyping. And stereotyping, I would even say, is not just a dangerous mistake, it could be deadly. And that dangerous mistake is, oh, thinking if someone's reporting that something's not right, I'm not feeling right. Oh, they must be exaggerating. They're lying. They're not taking care of themselves. Send them back home, right? So understanding that, I'm going to put the onus on us, but I also think those systems, like, so, the providers, those hospitals, and like, for them to understand, like, believe Black women. If we're reporting symptoms and something doesn't feel right, um, that is your chance to take us seriously. Because if not, we've heard far too many stories where it could be a preventable death because you are not believing a Black woman and recognizing your biases and the fact that some of that they might be unconscious because of the society that we live in that to see that all like people's lives matter, right? It doesn't depend. And I would even say some of the advice that I even give to kind of like, practitioners that are encountering these Black women is one way is to, something that you can do in your everyday life is, when you encounter Black women, treat them the way that you would see or treat someone that you care for. If that was your sister or your mother or your aunt, right? So kind of like treating someone the way, like that value, the way that you would treat someone that you really care for, that you really value, that can make a difference as well. But just seeing that that's a life that has value. That is somebody who is somebody to somebody or to a family, right? And so those would be some of the things that I would say in response to that question.
Yeah, absolutely. Thank you. There's so much wisdom. Go ahead, Dr. Arma.
It reminded me of one other thing that I think we can do that we don't realize that we have power, which is to advocate. And not just advocating with your local person, because it could be your doctor is still not giving you what you need, or you can't find what you need. And so recognizing that our legislators really care about what we have to say. And so an email, a phone call, and you be surprised. They'll respond back to you, letting them know that something is not happening that needs to be happening. You're not getting the care you need. And I know for sure because sometimes I've gotten the message from the legislator saying, hey, I'm trying to find some services for this, my constituent. They need some help. What can you do to help me? Or where can I go? So please lift up your voice, not only with your local practitioners, but also with your legislators. Let them know what you're struggling with.
Absolutely. Yes, you took my part, but I love it. No, it's okay. We're all sisters here. So, yeah, we have some fabulous legislators here in Connecticut, but also throughout the whole United States, right? And so I would encourage women, and not just women, young women, teenagers, men, because those are the women in your life that you are partnering with, and your sisters and your aunties and your mamas. Start Googling Black maternal health legislation, type in your state and find out what bills are in play in your state, and then send a note to your legislator, your state representative, or your state senator, and start having those conversations and letting them know that this is important to you. I would also give a shout out today to Black Mamas Matter, that organization. They do great work. I had a Black maternal health pin that I forgot to wear today, so let's just pretend it's there. I'll wear it the next time, but they're doing great work. And there are lots of events happening both in Connecticut and nationally. So we will include those links in the social media post so that you can have access to those events and be sure that you're on the lookout and that you're going and you're learning and you're growing in this content. Is there anything that either of you would add before we close out?
I think just specifically around women and Black women is recognizing that there are a couple of things that we can be doing and that we might need to get support on. Things like breastfeeding, making sure that you're getting support around that because there are a lot of associations with some positive outcomes in our lives if we are getting an opportunity to breastfeed. So it's like a random side note, but it's just something there's some really good data around it. We could talk for 10 years about all of the things that can also be done. But again, it speaks to speaking up and getting help and support.
So, Dr. and
I
Dr.
would just add great points, and I would add the importance of not just your social connections, but really guarding and protecting your mental health, especially during these times. And so there was great advice that was given here, but just to really, really safeguard your mental health. I think that's very important as well.
Wonderful. Well, thank you so much for our chat and our discussion here. I hope that the folks out there learned a lot. I know I always learn so much when I'm in space with both of you. Thank you, everyone. And stay tuned for our next broadcast where we share a little bit more on Black Maternal Health Week closer to the end. Let's see what we can find out what's going on. And be well. Thank you so much.